Hello listeners, today I'm going to share a very interesting remedy. This remedy is made from the measles nosodes and its name is Morbillinum. Morbillinum is famous for its action in measles related issues or vaccine related issues. But today I will share some very interesting and rare symptoms of this remedy. To explain this remedy further, let me share a case of this remedy. It's a case of a 3-year-old boy. Its main complaints were a constant high-grade fever with a lot of fatigue and tiredness. He was mostly sleeping whole day. But before this episode, he was a very active boy. The history of the patient was that this boy got chickenpox a week ago. During that chickenpox episode, he got this high fever. Parents gave him paracetamol without any effect. Then suddenly this boy got this convulsions, fits. In panic, parents called the ambulance. When ambulance arrived, they gave him some medication to handle the high-grade fever. In minutes, this boy stopped breathing because that medicine reacted on his body. When paramedics saw this reaction, they immediately called air ambulance to bring this child to the nearest emergency hospital. Anyhow, in that hospital, this child stayed for a few days. Although he was recovered from the chickenpox, but his fever, this high-grade fever, was still there. All his tests were normal, so hospital, the doctors just sent this boy home. But this boy was constantly getting this daily high-grade fever with this sleepiness and extreme tiredness and dullness. Moreover, he was also getting this hallucinative states. This boy got this hallucinations that somebody is in his room, which make his parents a lot more worried about his mental condition. According to his father, this boy has this sleepy eyes, means his eyes are half open. He cannot concentrate on anything, or he's just very sleepy. He do not show any sign of the pain. Now let's analyze this case. What we see in this case is this high-grade fever, tiredness, and sleepiness. This patient is constantly sleepy and these hallucinations. And the second prominent symptom is body reaction to the medication. These are the few key features which we see in this case, and this whole case revolve around this chickenpox related symptom or this high-grade fever, or this whole episode of infection. There is no other cause or clue in this case. As I'm discussing with you about nosodes, keep in mind we use nosodes where the whole case revolve around a single organ or a single infectious disease. Or you can also use these nosodes remedies where the patient never well since the last infection. Now let's talk about this remedy Morbillinum. In the classical literature, this remedy is used in measles or measles related issues, and this remedy is also mentioned as a prophylactic against infection to clear up after effect of any attack of this measles. Now, why Morbillinum? Why not other nosodes which are mentioned under the chickenpox? Interestingly, Dr. Sarkar has mentioned this remedy in progressive neurological disorder characterized by the inflammation of the brains. And he also mentioned this remedy under the Guillain-Barré syndrome, which is a very rare neuro disorder, which show its effect on the nervous system. That this remedy has special affinity on the nervous system. And this is also a reason why I prescribe this remedy instead of any other remedy, because this remedy has this very profound neurological symptoms which other remedy doesn't have, which comes under this chickenpox issues. So what we see in other nosode which are mentioned under the chickenpox, they do not cover these symptoms which I have mentioned above. There are two other main symptoms which are mentioned under this remedy for example, tiredness or debility, or you can call it weakness during or after the attack of fever. And the second thing is convulsions. On this basis, I have given him this Morbillinum 30, 4 doses. Now, reaction of the remedy was very profound. A few hours after taking the first dose, this boy became more aware of the surroundings, more lively. His eyes become more sharp. And next day, he started jumping and teasing his little sister as usual. After a week, his father called me and said that this boy got this cough. And we are worried about this cough as well. So I asked them to repeat 2 doses of Morbillinum, which cleared the case. Keep in mind that Morbillinum also mentioned under cough and pleurisy. So this remedy has this cough or lungs related issues as well. Now I'm going to talk about its relationship with the other remedies. Some homeopaths only prescribe Morbillinum in the cases of measles or measles related issues, or some vaccination issues. But I have used this remedy in number of other conditions where its prominent symptoms are there. You can always use this remedy. Keep in mind that homeopathy remedies are not the remedies for diseases. It's the remedies for conditions, symptoms. So when there is a symptoms of this remedy, you can always prescribe this remedy. Morbillian symptoms look very much like belladonna because of its high-grade fever and convulsions or hallucinations, which is a part of Solanaceae group. If you just see in the repertory, you can find a lot of Solanaceae, Stramonium, Hyoscyamus, and belladonna under these convulsions, which are related to high-grade fever. But what is different here is the daily episode of high-grade fever, which is a kind of recurrent. Belladonna is used mostly in the cases of acute phases of the disease or acute conditions like high-grade fever, but it hardly used in this recurrent episodes of conditions. According to Shankaran, malarial miasm kind of episodes, the disease comes and goes. So this kind of episodes you hardly see in belladonna cases. So that is the reason why I was hesitating in prescribing belladonna in that case. Interestingly, classical teachers like Dr. Clark has given Morbillinum alternative with belladonna. So it has this belladonna symptoms as well. And Dr. Shepherd has mentioned to give 1 or 2 doses of Morbillinum and then go back to any other constitution remedy according to the individual symptoms. But again, here is a rule of thumb that Nosodes remedies can be prescribed as the main remedies, or sometimes they are used as intercurrent remedies. Vermeulen has also mentioned this remedy in low-grade fevers, and he also mentioned to give this remedy to those kids who got this reaction from MMR vaccine. Dear listeners, I want to emphasize here, please do not self-medicate. Always consult your homeopath, your GP before taking any remedy, especially these nosodes and sarcodes, because these are very deep acting remedies, and do not take these remedies without consulting a proper homeopath. Especially in severe conditions, you must consult your GP, your doctor, your homeopath before taking any medication or any homeopathy remedy. I hope you enjoyed today's video. If you have any question, please let me know. See you next time in any other video. Bye.